If you have hypothyroidism, should you go gluten-free? Should you do a gluten-free diet? I mean, it's all over the Googler Schmoogler. I'm going to answer this question as to whether you actually need to do this for your health. Guys, I'm Dr. Jen Caudle. It's good to see you. All right, so let's level set a little bit, okay? Now, the most common cause of hypothyroidism is something called Hashimoto's thyroiditis. This is an autoimmune disease, okay? That means where the body mistakenly attacks itself, okay? So that is a little bit about Hashimoto's hypothyroidism. Now, let's talk about celiac disease, which is one of the reasons why people ask about gluten. Now, celiac disease is also an autoimmune disease. Now, what goes on with celiac, you may wonder? Well, it's a condition where people who have it, if they eat gluten, which, by the way, is a protein found in wheat, barley, and rye, when they eat this protein, it causes the body's immune system to mistakenly attack the lining of the small intestine, so it attacks their gut. As I was editing this video, I realized I didn't come out and explicitly say that celiac disease is an autoimmune condition. Yes, it is an autoimmune condition, just like Hashimoto's thyroiditis. That's important. Now, you're probably saying, well, what's the connection between the two? I often say that sometimes where there's one autoimmune disease, you may find another. Autoimmune diseases tend to sometimes come in packs, right? So having one autoimmune disease can make it more likely to have another. And there are a certain number of people, certainly with Hashimoto's hypothyroidism, that also have celiac disease. So let's go back to this question that I know you're asking. Okay, if you're hypothyroid, should you then avoid gluten? Well, the truth of the matter is you only need to avoid gluten if you have celiac disease along with your hypothyroidism, or you have a gluten sensitivity or gluten intolerance, okay? If you don't have a problem with gluten, you don't have celiac, you don't have gluten intolerance, you don't have gluten sensitivity, then you can eat gluten. So I just want to make that clear, that having Hashimoto's hypothyroidism doesn't automatically mean that you have a gluten sensitivity or gluten intolerance or celiac and that you need to stop gluten. It's fine to eat gluten unless you have those conditions. Now, you might say, well, how would I know? Well, the way that you know is you got to talk to your doctor. Oftentimes we can do blood work. Often there are also endoscopies that can do biopsies and check to see if you have celiac disease. So talk with your doctor. We can help uncover if you actually do have a gluten intolerance, sensitivity, celiac disease, in which you may need to avoid gluten. But if you just have Hashimoto's hypothyroidism and no gluten problem, you can eat gluten. So go ahead. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I hope this video was helpful. Let me know in the comments. Share this video with your family and friends. Subscribe to my channel on YouTube. I'm on Instagram, TikTok, LinkedIn, Facebook, Threads, all the things. Please follow me in all the places. Also, sign up for my free health newsletter. I have it. You can go to drjencaudle.com to sign up. All right, guys. Love y'all.